I want to share with all of you something I have come to learn about our great nation. Now, I didn't learn about it until I went to my mom's house so she could teach me how to make fried chicken. Now, everything is going fine, and then all of a sudden, she grabs her side in pain. I ask her, "Why haven't you gone to see a doctor, Mom?" She said it was because her doctor no longer accepts Medicaid. So, I have to drive 30 miles to Springfield for a doctor that can. So I had to ask myself, why are some physicians not accepting Medicaid, Medicare patients? At first I figured it was discrimination. I've actually been to a clinic before where the nurses do not care much for Medicaid patients. I was having a physical and wanted to start a conversation to keep things from getting awkward. I asked one of the nurses, "Do you like the clinic?" She tells me I love my job, I enjoy caring for people and meeting new faces. I like this clinic more than the other one I used to work at. I was like, cool, cool. Trying to keep things from going, I asked, "Why do you like this clinic more?" She said at her old clinic, they got a lot of patients that smelled and had bad hygiene. Here, they don't see as many Medicaid patients. It suddenly got awkward again because I was on Medicaid. I asked myself, I'm on Medicaid and, you know, do I stink? Since then, I've had a preconceived notion that physicians discriminate against Medicaid patients. Once I learned about the Patient Protection and Affordable Health Care Act, better known as Obamacare, I began to notice the truth. So, in case you people don't know, Obamacare has been a well heated topic since its release March 3rd, 2010. According to Sarah Rosenbaum, a Juris Doctor, it was implemented to provide health care coverage for 94% of Americans, which would increase Medicaid enrollment by 15 million. It aimed to approach almost universal coverage at the expense of the government, individuals, and employers in order to improve quality, efficiency, reduce wasteful spending, acknowledge a diverse patient population, and expand clinical preventive care and expand community investments. Now keep in mind this was said by a Juris Doctor. We all know Juris Doctors are not always sympathetic. The AARP Primetime Radio, on the other hand, was actually very sincere in their special ACA radio broadcast in 2011. They seemed to touch base with the more patient perspective. The way they explained the act, young adults can stay on their family's health care plan until 26 and do not have to live at home. Children cannot be rejected by a policy due to a pre-diagnosis, nor can they reach a limit of coverage. The act also helps the elderly. It helps them through dealing with a donut hole. This is when you have to pay for your medications out of pocket. The ACA expansion also covers disease test checks such as diabetes and regular preventive checkups. Now, primary care givers in rural areas get extra compensation from the government to promote primary care under this new act. This is great because we all know that primary care physicians get paid the least of all physicians, yet are so involved with communities. Now, physicians have been required to fill out huge amounts of paperwork for patients with insurance, including Medicare, Medicaid, for well over 2 decades now. More coverage means more paperwork. The amount of paperwork has also increased throughout the years. According to Dr. Hubbard, the amount of paperwork used to be 4 pages per patient with a stroke. Now it is 78 pages. Dr. Hubbard explained that this decreases efficiency because that time could be spent seeing more patients. Now, the pre-authorization segment states that the physician's route of care has to be approved before being compensated for that care. If you ever wondered why your test results or x-rays have not came in, this is probably why. Now, I can understand that the ACA is terrible when it comes to efficiency, but I feel that should not have permitted physicians to decline care to patients with Medicaid or Medicare. Moreover, I figured it also had to do with low reimbursement rates. After all, it's human nature to be greedy. To me, because Medicare and Medicaid have low reimbursement rates, that was the actual driving force behind this denied coverage. What I came to discover through an interview with Dr. Hubbard and a video published by Reason TV is that it was not entirely the case. Now, Reason TV explained the ACA through the eyes of 2 doctors, right? Dr. Eck and her husband. Now, they volunteer at a free healthcare clinic in New Jersey. Patients that they see are insured through Medicaid, but come to the free clinic due to doctors not seeing them because of the new Medicaid expansion. Now, Dr. Eck only works with Medicaid patients at the free healthcare clinic because she cannot afford to do so at her own private practice. She states with the rates it is impossible to pay her employees and maintain infrastructure. Dr. Hubbard made the Affordable Health Care Act seem further removed from sounding logical. He stated the federal government takes advantage of the charitable nature of physicians. They may reimburse for services at a rate below the cost incurred to provide it. So you provide a service that would normally cost your business $50 to give, but you are only reimbursed $30 for it, right? You must either decide to limit the number of Medicare, Medicaid patients you see, or choose not to see any of them. Now, the Center Services for Medicaid passed legislation many years ago that stipulates that a physician who accepts Medicare, Medicaid must see all such patients who fall within that physician's scope of practice. Now, the only strategy you have left is to choose not to see any of them. What I gathered is that the reason physicians are not seeing Medicaid and Medicare patients is due to increased paperwork, pre-authorization, both of which decrease efficiency and low reimbursement rates, which make it hard to run a private practice. Unlike huge hospitals or large medical groups, private practices have the ability to serve small towns. Now, if they go under or are forced to stop seeing Medicaid and Medicare patients, then patient access to care diminishes, causing patients to drive 20 or even 30 miles just to see a physician. Now, the Affordable Health Care Act, I only hope that it will increase reimbursement rates, decrease the amount of paperwork, and limit pre-authorization, while still keeping deductibles low enough for patients like my mother.